official, cleared to play. We're taking you inside the tent, get you updated on the latest injuries in the Bay, and proud to partner with UCSF Health in this segment and bring in Associate Professor of Orthopedic Surgery, Dr. Pandya. Doc, hello again.
Good. How you doing? It's been a long time.
Yeah.
It's been a long time.
Does it feel less like an emergency today than it did yesterday?
Yeah, there's a little bit of after the reports this morning, now there seems to be an emergency again, but it seems hopefully it will be calm.
Can I start with that? I would love for you to speak on the level of responsibility for sports orthopedic surgeons who speak in media with regard to what they see over a television set.
Yeah, I think the key thing is that for all of us who kind of do this injury analysis, you always have to preface by saying, I haven't examined this patient. I haven't looked at his MRI. I don't know the inside medical knowledge. This is just my opinion based on my experience and what I see. I think where it gets difficult, and what I think a lot of the, especially with social media now, is that someone gives an opinion and everyone assumes that this is the person who's actually taking care of him, seen his MRI scans, et cetera. So I think there is a responsibility for us to do this, to say, look, I'm not actually I'm not looking at this patient. I'm not looking at the MRI scan. I simply am giving my opinion about what the possibilities are, but the team physician, his medical staff, are the ones who are determining what treatment he's going to need.
To give our listeners the background, Dan Patrick's show earlier today, the doctor, and again, what's the guy's name? I keep not even wanting to acknowledge it. Dr. Addix comes on the Dan Patrick show and take a listen, says this.
Everybody kind of wants to say, oh, maybe it's just partial. They're hoping that the next doctor will tell them they don't need surgery. I mean, looking at the hit, looking at his absolute inability to throw the ball, it looks to me like he needs surgery. He needs Tommy John surgery. And, it generally is a year. Steven Strasburg came back in a year in baseball. We had Jake Delhomme came back in just over a year, actually. He was hurt in week 3 and then came back the following season, had probably his best year after he had Tommy John. So it's not that I don't think he'll be able to come back and play well. It's just that it may completely make next season not an option.
Okay, so Doc, I've listened to you and others enough to know that there are two different kinds of surgery. I don't think anybody's saying Brock doesn't need surgery. It's just whether it's a repair versus a reconstruction. But I mean, do you concur with what you heard there, or what's your take?
I think what it comes down to is that the determination of what you do with this, whether even if it's not surgery, what type of surgery, is what the ligament actually looks like on an MRI, and then what it looks like during the time of surgery. So they're going to make the best decision for him long term, but there's no reason to do a Tommy John surgery. If the ligament actually looks pretty good and you can repair it on an MRI, there's also no reason to go down the surgery route if this new MRI, or if he gets more imaging, shows that actually, this is a partial tear. So I think absolutely you have to kind of take all the information into consideration, and none of us know what the ligament actually looks like on MRI and what it'll look like during surgery. And that's going to determine what it is for him long term. So I think it's very hard, particularly with these kind of injuries, to base it off of video or what people say. It's what you're seeing in there when you're in surgery and what the MRI looks like, which none of us will know until, a couple days after his surgery.
So
if he gets that done.
So we're waiting on some Brock Purdy news, but Trey Lance yesterday offered some news on his surgically repaired ankle. He said his boot will be off this week. He's hoping to be fully cleared in 3 to 3.5 weeks, and then 100% by OTAs in June. Is that about right for him to be fully recovered? Like, do you foresee him having any restrictions once he does take the field?
I think as long as he continues on this progress, it doesn't have any setbacks, and I think that for patients who generally have this kind of procedure done, yes, he should absolutely be back as long as he's able to get his strength back. Clearly, we know that the bone has to be healed because he wouldn't take the things out unless his bone was healed. And any source of irritation that kind of plate screws, whatever he had in there, was causing has not been dealt with. So I think it does set him up well for the next several months to basically be ready, unless he has some lingering soreness or some sort of muscle issue develops. But just knowing in general, when you look at all people who have this kind of ankle injury, they get back, and he's right on the timeline to get back right at that time point. So I think that he's got enough time to recover. He should have enough time to get his confidence back. And I think he should be ready for OTAs, barring any kind of setback that may unexpectedly arise.
Doc, it's not just back. One thing I've wondered is, because Trey Lance was, at least billed as this quarterback who was going to use his legs so much, is there any reason to think that he won't not just be back, but like the full mobility and full speed that he had as a college player? Is that all expected to return?
That's a great question. That's hard. That is really hard to predict. I mean, I think you look at the two players that we know recently who've had that were quarterbacks. I mean, Derek Carr had that with the Raiders, and he kind of took him a year or two to get his mobility back. And we saw Dak Prescott. He had kind of a similar type of ankle injury, and most of the time they do get their mobility back. You do see it more year two. This first season, you may be seeing a little bit hesitancy in terms of that explosiveness and getting out of the pocket. But I think that by year two, hopefully if he's still with the 49ers, you'll see that. But I think there will be definitely a ramp-up period where he'll be potentially more in the pocket as opposed to being as explosive, just simply due to the fact that it takes a while to get that confidence back, that mobility, that strength to play at that level.
When NFL players go into the offseason, is there some kind of balance that players need to strike between, conditioning and strength training versus injury maintenance? Can you overdo off-season training and to the point that it increases your injury risk?
No, absolutely. Yeah. I mean, I think in general, we have this concept you need to be working out all the time. I think just like we're kind of seeing with load management in the NBA, there's a lot of power to the body in terms of resting, more so than even what you may definitely gain from working out. So I think in general, when football players are coming into the off season, you obviously get your structural injuries taken care of. But in general, you need a good 6 to 8 weeks just to let your soft tissues to heal. Now, that doesn't necessarily mean you're just laying around on the couch. There's this concept of active rest where you're doing other things. You're swimming, you're biking, you're doing other things to maintain that degree of kind of fitness while not stressing the joints. And then you do definitely want to get your body ready for football shape. And one of the things we saw in the kind of the COVID-shortened season where there wasn't a lot of preseason kind of work in was that you see all these ACL injuries, all these big injuries happening the first couple weeks of the season because no one had a ramp-up period. So it is a balance. You spend the first half of the off-season kind of letting your body calm down, making sure you're not getting into those soft tissue issues re-aggravated. But then you do need to kind of work yourself in so that you're not suddenly getting a huge amount of load come OTAs and then getting all those injuries again.
Hey, Doc, real quick before you go, did you see anything in Jalen Hurts or Patrick Mahomes that you think will have an effect on the Super Bowl?
I think both of them, actually. I think Jalen Hurts, even though he did well against the defense, you could see him grimacing and not necessarily, every time he got hit a little bit, his shoulder seemed to be bothering him, little subtle things. So it'll be interesting to see, how that impacts him in 2 weeks. Mahomes, you saw some clips of him limping and things like that. I think given the fact that he was actually able to play a week after a high ankle sprain, I think in 2 weeks from now he's going to be totally fine. So I think we'll have a better chance of seeing a good Mahomes. Maybe still a little residual issue for Hurts in the Super Bowl. Okay, good stuff. Hey, Doc, as always, thank you so much, and we promise not to call you tomorrow. Okay, absolutely, no problem, guys. All right.
Thanks, Doc.